Good day. I'm going to share some important facts on the relationship between the obese and high blood pressure, and it is commonly cause of high blood pressures today. First and mainly, I want to educate or provide helpful information. I'm not here to discriminate or shame anyone. Rather, I'm here to give some provide important details that we can use to live a good life. Naturally, we usually believe that as we reach the age of 30, we will get chubby or that our metabolism will slow down. Now, what is obesity? Obesity is a term used to describe people with a body mass index above 30, and it's a major risk factor for high blood pressures when you are overweight or obese. Your heart has to work harder to pump blood through your body, but all the extra effort puts strain on your arteries. Your arteries, in turn, resist this flow of blood, causing your blood pressure to rise. Together, obesity and hypertension combine to create a leading cause of cardiovascular disease. You are at especially high risk if you tend to carry your weight around your abdomen. Additionally, obesity puts strain on your kidneys, which puts even more strain on your heart. When you are overweight and your blood pressure is too high, the high pressures damage the tiny blood vessels in your kidneys. The walls of the vessels thicken and limit blood flow, making it harder for kidneys to filter your blood to remove waste and fluids. When your body is not able to remove excess fluid, your heart has to work even harder. You can take steps to reduce your blood pressure, but with obesity as a compensating factor, you may need to make several lifestyle changes. In addition to take some blood pressure medications called an antihypertensive. Speaking of medication chances that your doctor will want to prescribe blood pressure medication for you. Commonly prescribed blood pressure medicines include ACE inhibitors, calcium channel blockers, and low-dose diuretics. For obese patients with high blood pressures, doctors may prescribe ACE inhibitors and angiotensin second receptor blockers. Some people may need to take 2 or 3 different medications. Other drugs are available, but the possible side effects might push them down the list. For example, in every specific cases, doctors might be prescribed beta blockers to treat high blood pressures. Beta blockers work to reduce the amount of oxygen your heart needs. They slow your heart rate by blocking your heart sensitivity to adrenaline, a hormone produced by the adrenaline gland that causes the fight or flight reaction. But beta blockers have been shown to be associated with weight gain in some people, so their use generally limited to certain situations, like after a person has a heart attack. But this is not the end. There is hope on how to prevent this disease. Upon doing a physical physical exercise, like regular physical activity makes your heart stronger. A stronger heart can pump more blood with less effort. As a result, the force on your arteries decrease, lowering your blood pressures. Regular exercise also helps you maintain a healthy weight. Another important way to control blood pressure: if you are overweight, losing even 5 pounds can lower your blood pressures. To keep your blood pressures healthy, you need to keep exercising on a regular basis. It takes about 1 to 3 months for regular exercise to have an impact on your blood pressure. The benefits last only as long as you continue to exercise. The question is, how much exercise do you need? According to the experts, you should try to get at least 150 minutes of moderate aerobic activity or 75 minutes of vigorous aerobic activity a week, or a combination of the two. Aim for at least 30 minutes of aerobic activity most days of the week. Um, if you are not used to exercise, work slowly towards this goal. You can break up your workout into 3 10-minute sessions of aerobic exercise and get the same benefit as one of 30-minute sessions. Mm, but before anything else, uh, if you have a, if you have a high blood pressure, you should be able to be more active quite safely. But to be on the safe side, it's always a good idea to speak to the experts, such as doctors or nurse. You should, uh, you should, you should, you should ask the experts before you start any new physical activity. Physical activity will cause your blood pressures to rise for a short time. For most people, this is nothing to worry about. And when you stop the activity, it should quickly return to normal. If your blood pressure is really relatively high, your doctor or nurse may prefer to lower it with medicines before you start exercising. If it's very high, avoid any new activity without taking to your doctor first. Use the table below to get an idea of whether it's safe to exercise, but speak to your doctor or nurse about what's safe for you. That's all. Thank you.